Hi everyone and welcome to our video. So today we'll be talking about high frequency currents and examples of high frequency currents in electrotherapy include ultrasound, microwave diatony, shortwave diatony, IRR, UVR, and laser. So these are some examples of high frequency currents. So high frequency currents are currents which alternate so fast between the motor and sensory nerves that they do not stimulate any of them. So we're looking more at that as we go on with the video. So they mainly work on two principles, which are the nerve stimulation limits and the thermal conversion. So nerve stimulation limits, your everyday electrical currents like the low and the medium frequency, they move slowly enough for the nerves and cells to react to them. This is why they cause like a tingling sensation or make your muscles twitch whenever you are hit by them. However, high frequency currents that switch back and forth incredibly so fast, more than like 100,000 times per second, because they move so fast. So because of these, your nerves cannot keep up, and this prevents any painful electrical shock or muscle twitches. When it comes to the thermal conversion, instead of shocking the nerves, this fast moving of the energy causes the molecules and the ions inside your body to vibrate or rub together or rotate rapidly, and this causes like internal friction. Once this causes internal friction, the electrical energy, like which is within, it is evenly distributed, and heat is generated in your body. So moving on, we've got like shortwave diagram. And looking at the classification of diagram, you've got shortwave, microwave, and long wave, and they use different frequencies. So diathermy simply means using electrical currents to produce deep heat inside the body. You know, and we've got mainly these three types basically, and then they use different frequencies. So looking at shortwave diagram, it is two circuits. This is the oscillator circuit and the resonator circuit. So with the oscillator circuit, this is the internal part of the machine that builds up and creates the high frequency current using electrical components like a valve, a capacitor, and an inductor. And then the resonator circuit or the patient circuit. This is the part that is adjusted by the therapist so that the machine's internal circuit or internal settings perfectly matches the one that is outside or the main frequency, ensuring that there is sufficient healing or there is maximum healing energy transfers between the two machines and the patient. Then moving on to the therapeutic mechanisms, we've got the different heating targets between the cable and the capacitor method. So these are two different methods of shortwave diathermy basically. With the condenser method, it is destined for deep tissue for tissue healing that naturally resist electricity like the fat, body, and joint capsule. While the cable method mainly works on your muscle and your blood. Then the cable method, as the name says, cable. A cable or a heavily insulated wire is used around the limb, and then with condenser fluid or condenser method, you use two pads to two rigid plates or two rigid metal plates. And then the physics, they act on like the cable method, it creates a magnetic field that produces eddy currents. And then condenser method, it acts like an electrical capacitor and sending voltage straight through that area. And then moving on to the next, looking at this is just like the difference between the cable and the condenser method. So the orange is the cable, is the condenser, and then the blue is the cable method. So we see from these different surfaces, the skin, the tissue, and the bone, where exactly these different methods hit. Then moving on to the indications, you've got your joint capsular tightness, you've got your muscle spasm, you've got your chronic inflammation, you know. And then moving on to the contraindications, you've got pacemakers and the electrical implants. This is because the machine or the high frequency current, they create an electromagnetic interference, causing as a severe risk for electronic failure. So this is why it is contraindicated. Same thing when it comes to metal implants. The metal will absorb this energy so fast, and if this happens, you know, this can cause internal burns in the patient. Then we've got active bleeding or open wounds. This is because heat widens the blood vessels, it speeds up blood flow. So if ever this happens, this can cause severe bleeding or bruising. Then obviously in sensitive organs like the eyes, the taste, because of their highly sensitivity, do not offer these machines close to those areas. So this is all for our high frequency currents. Thank you so much.